Hello everyone. This video revolves on the topic called the general principles in corticosteroid therapy. But before that, let's define first what is corticosteroid. Corticosteroid has a class called glucocorticoid, in which the glucocorticoid drugs are considered to be the man-made versions of glucocorticoids itself. It is steroid occur naturally in the body. One of its functions is to interrupt inflammation. It also helps the body respond in stress and regulates the body in using fats and sugar. The figure 1 illustrates the general structure of the corticosteroid, where there's a presence of cato group essential for its functions. Since we have studied already the background of corticosteroid, let's proceed to its general principles. Glucocorticoids are palliative. It means it will just mitigate the pain or give the patient a relief, but no complete cure. It is also necessary to individualize the doses between patients. The figure 2 illustrates the biological process of glucocorticoids. Still on the principles of corticosteroid therapy, the initial dose must depend on severity of the disease. Start at high dose, then gradually reduce as the clinical signs subsides. Next, the prolonged therapy at high doses for several weeks may cause adrenal atrophy, meaning there's a loss of Acadz, the kind of hormone, and trophic support of adrenal cortex. There is also a possibility of suppression of hypothalamo-pituitary adrenal axis. Corticosteroid must also be administered locally rather than systemically, meaning the entire body is not affected by the route of medication used. Next in the list, glucocorticoids therapy must be terminated gradually. If not so, it may induce hypoadrenocortism or Addison disease. The figure 4 shows hypoadrenocortism, but luckily, it's not common to our dogs. Next, anti-inflammatory and anti-allergy therapy. It was studied that there's a great proportion of drugs used in the veterinary field just to combat allergy diseases and inflammation. These drugs are used in the treatment of chronic arthritis, an inflammatory disorder affecting joints. Also treats tendinitis, bursitis, conjunctivitis, dermatitis, pruritic dermatoses, allergic pulmonary disease, a disorder in the lungs caused by allergic reactions from inhaled microorganisms, and allergic gastroenteritis. These are all used in just short period of time in anaphylaxis, an allergic reaction, angioneurotic edema, still caused by allergic reactions from food, urticaria, a condition of itchiness on the skin, and serum sickness, an allergic reaction of the immune system from the medicine taken by the patient, especially those that contains proteins.